Hello and welcome to the Fall 2021 HIPS Student Symposium. My name is Savannah Valenzuela, and this semester I participated in a public health internship through the class PH 185FI. I'm going to go ahead and talk some about my experiences, what I learned, and some of the data that I collected. I'm going to go ahead and present my information in a PowerPoint titled Food Insecurity and Economic Hardship. We're going to go ahead and evaluate the measurement of food access that is correlated with economic and household hardship. I will show you that food insecurity and economic hardship are positive related, and I will discuss the methods to limit food insecurity rates through government assistance programs and outreach plans. Food insecurity defined. Food insecurity is an economic and social indicator of the health of a community. The USDA defines food insecurity as limited or uncertain availability of nutritionally adequate foods or uncertain ability to acquire these foods in socially acceptable ways. Why is food insecurity important? Because it encompasses eating unhealthy foods and healthy foods. Two factors that influence food insecurity rates are unemployment and poverty, which were both at recent lows heading into this pandemic. Before the start of the pandemic, the overall food insecurity rate had reached its lowest point since it began and be measured in the 1990s, but the improvements were being altered by the pandemic. According to Feeding America in 2020, 45 million, 1 in 7, including 15 million children, 1 in 5, have experienced food insecurity. Feeding America predicts in 2021, 45 million people will still be facing this food insecurity. Food insecurity rates. So food insecurity is especially high among households that are of a low income, they include children, or have recently had expected job loss. So looking at the median household income of each county can give us a general idea of the income of average households to determine whether they have financial need and whether they need to seek out healthy foods for their families. Access to healthy nutritional foods have a significant effect on overall health. Families in low income rural areas can face health disparities such as a lack of transportation, limited access to grocery stores, increasing costs of housing and unemployment. These indicators, they're relevant because we assess the vulnerable populations which are more likely to have multiple counts of needed access, needed health status, or social support. There is a large obesity epidemic that is fueled by unhealthy eating and foods. Ensuring everyone has access to healthy choices will improve the overall health in the community. So now we can now take a look at some of the underlying causes of food insecurity. The federal poverty line. Poverty and unemployment rates can help analyze the need based on geographic location when we organize the data by county. As you can see, when we look over at the chart, the poverty rate is much higher than the unemployment rate. Madera and Fresno counties have the highest percentage in poverty rates based on their population at about 20%. In each of the given counties, we can target specific demographics such as students, seniors, homeless families, and the disabled to spread awareness and information about the resources available for low income to help balance their bills. So balancing competing housing, healthcare, transportation, and food costs, they're important for all adults to avoid debt and living under the poverty line. Government assistance programs are a great tool to help individuals and families during these times to separate from this poverty line. Assistance programs. A great national government program is CalFresh, which I work closely with this semester through the Central California Food Bank. CalFresh is formerly known as Food Stamps, a nutrition assistance program for eligible low-income families to help purchase, help, and eat healthy, nutritious foods. CalFresh is one of the first lines of defense against hunger. Nationally, this program is known as SNAP, Supplemental Nutritional Assistance Program. CalFresh can be used to CalFresh can be used to purchase any foods or food products for human consumption except hot foods, prepared foods, or heated in the store. We have to go ahead and look at work on educating and informing individuals to participate in CalFresh to benefit from the government programs. We can go ahead and look at the data from the unemployment rates and the poverty rate and compare it to the percentage of the population that are receiving SNAP benefit or that are receiving public assistance. We can compare the two and help bridge the gap between the two. And the ways that we can help bridge this gap is through outreach and education. Outreach and education, reaching out to the community partners, localization, emails, phone calls, flyers, any way we can reach out to the local community or local organizations is a great way to help outreach and spread the word. Attending events to host a table with information about the program while providing opportunities to pre-screen, to sign up for CalFresh is a great way to get the word out about CalFresh and help educate the population. Overall, I had a great experience with my internship this semester, and I learned a lot about food insecurity and how to bridge the gap between economic hardship and food access. Thank you. These are my resources right here.